Hello, my name is Andrea Leon-Popovych. I'm a registered nurse and currently a student at Monmouth University. The topic of today's teaching presentation is about dietary phosphorus management in adult patients with end-stage renal disease on hemodialysis. Kidney-friendly, phosphorus-friendly diet for people on dialysis can be challenging. Therefore, the purpose of this educational session is to provide ESRD patients information on dietary phosphorus management to improve knowledge and phosphate control adherence. Hello, my name is Andrea Leon-Popovych. I'm a registered nurse and currently a student at Monmouth University. Kidney-friendly diet can be challenging. Part of a kidney-healthy diet is tracking or avoiding minerals like sodium, potassium, or phosphorus. Today, we will focus on phosphorus. This educational workshop will be enhanced by a PowerPoint presentation, 2 videos to reinforce the learned information, a handout, and a brochure to take home. We'll also play a little game called Find the Sneaky Phosphorus, and at the end of this session, we'll discuss any questions or concerns regarding this topic. So what is phosphorus and why is it so important to you? Phosphorus is a mineral that is important for many body functions. Phosphorus is found in many foods, and with another mineral called calcium, phosphorus is needed to build strong, healthy bones and teeth, as well as to keep blood vessels and muscles working. So why is phosphorus important to you? The body needs some phosphorus to stay healthy. Healthy kidneys usually filter and get rid of the extra phosphorus from the blood. In kidney disease, however, they don't do their jobs as well as they should. And when your kidneys are not working properly, phosphorus can start to build up in your blood. That's why you need to control how much phosphorus you're putting into your body. When your kidneys are injured and you need hemodialysis, there are 3 ways to control phosphorus: by the amount of phosphorus you eat, by taking phosphorus binder medication as prescribed, and by hemodialysis treatments. Although phosphate binders help control the amount of phosphorus in your body, you will still need to watch how much phosphorus you eat. So let's focus on phosphorus intake. Important to know that by sticking to your diet, the food that you're eating, you're actually doing a major part of the job of your kidneys. In order to control your phosphorus diet, you need to know foods high in phosphorus, foods you need to watch closely and you want to limit, and also foods low in phosphorus, foods that are okay to include in your food choices. Foods high in phosphorus. Phosphorus can be found naturally in protein-rich foods such as meats, poultry, fish, nuts, beans, and dairy products. Keep in mind that phosphorus found in animal foods is absorbed more easily than phosphorus found in plant foods. Some of the low phosphorus choices to choose from include fresh fruits such as apples, apricot, grapes, pears, peaches, plums, pineapples, fresh vegetables like asparagus, carrots, cauliflower, celery, green beans, or broccoli, breads, pasta, rice or rice milk, corn and rice cereals, sherbet, home brewed iced tea or light colored sodas such as ginger ale, or fruit juices. Signs and symptoms of too much phosphorus. Too much phosphorus in your blood pulls calcium from your bones, making your bones thin, weak, and more likely to break. High levels of phosphorus in your blood can also cause itchy skin, bone and joint pain, or muscle weakness. Too much phosphorus can also build up in your heart and blood vessels. As a result, your heart and blood vessels can become stiff and narrow, which cause heart disease or stroke. Phosphorus is tricky because it can be hidden in foods. Phosphorus may be added to foods to taste better and last longer. They are called phosphorus additives or preservatives. It is important to know that phosphorus from food additives is completely absorbed. By limiting these phosphorus additives, you will definitely have a better control over your phosphorus diet. Some food labels will list phosphorus, such as the one I'm showing you, phosphorus 25%. However, you don't have to. Look for the letters PHOS on the list of ingredients to find phosphorus additives in your food. Food types with added phosphorus. In your handout, you'll see the major food categories with additives or preservatives. These are fast foods, ready-to-eat foods, canned or bottled beverages, and most processed foods. Most processed foods that sit on a shelf, in a freezer, or in a can will likely have food additives. Let's play a game called Find the Sneaky Phosphorus. On my PowerPoint slide now, you see a list with long and confusing additive names. Look for the letters PHOS, highlighted in red, to find the phosphorus additives. Now, let's play. Now, I want you to be a phosphorus detective. On the bottom of your handout, you'll see 4 very sneaky additive names. Circle as many PHOS letters you can find in these words while I'll go around to see your detective work. Now that we're done with the Sherlock Holmes job, let's watch 2 educational videos to summarize everything that we've learned.
Hi, my name is Laura Cochran and I'm a registered dietitian. If you have kidney disease, you may already know you need to watch the phosphorus in your diet to avoid problems like heart disease, damage to blood vessels, or weak and brittle bones. This video will explain the connection between phosphorus and kidney disease and give you some tips on how to manage phosphorus. Let's talk about why that's so important. Phosphorus is a mineral that teams with calcium to keep your bones and teeth healthy and strong. Phosphorus has other important roles in the body. Some of these are to build your blood cells, keep your muscles working, increase your energy, and improve digestion. Most people end up eating more phosphorus than they actually need. It is the kidney's job to filter out and throw away the extra phosphorus that the body doesn't need. Imagine you're in a coffee shop. Imagine your kidney as a coffee filter. A coffee filter keeps out the gritty grounds, but allows water to pass through the grounds to make that perfect cup of coffee. Healthy kidneys allow just enough phosphorus through into the blood to keep the body healthy and then gets rid of the rest. When you have kidney disease and your kidneys' filters are broken or overworked, too much phosphorus gets through into the blood. The body likes to have an equal amount of phosphorus and calcium in the blood. When you have too much phosphorus in the blood, your body will pull calcium from the bones in an attempt to match the amount of phosphorus in the blood, causing bones to become weak and brittle. This condition is called hyperphosphatemia. If there is a combination of too much calcium and phosphorus in the blood, together they can make the blood vessels hard. Then the blood vessels and the organs they supply blood to can get damaged. If this happens, a person might not feel any symptoms, or they might feel joint or bone pain and even experience broken bones. It is important to eat low phosphorus foods to help keep the phosphorus levels in your blood from getting too high. A dietitian can help teach you and your family how to select these foods. It is also important to exercise, even if it's just in a chair, to help strengthen your bones. Even when people watch what they are eating and try not to eat foods with a lot of phosphorus, that may not be enough to keep phosphorus in the blood normal. Then they might need to take a special medicine called phosphorus binders or phosphate binders. This medicine helps soak up the phosphorus from food in your stomach before it goes into the bloodstream. This may seem challenging at times, but with a little planning and preparation, you will find plenty of delicious foods you can enjoy. Hi there, my name is Laura Cochran and I'm a registered dietitian. If you have kidney disease, you may already know to watch the phosphorus in your diet in order to avoid problems like heart disease or weak and brittle bones. This video will explain the connection between phosphorus and kidney disease and give you tips on how to manage phosphorus. Navigating the grocery store for a low phosphorus diet can be intimidating, but all it takes is the right shopping strategy. So let's play a little game of Everyone with kidney disease has a different diet depending on their body's needs, but there are a few common keys to success. Develop a list of brands and foods that are low in phosphorus and keep that handy when grocery shopping. Your dietitian can help you put this together. Meet Lisa. She has kidney disease and is on dialysis. She is going to walk us through how to pick the right foods to maintain a diet that is low in phosphorus.
Thank you. I'm excited to be here.
Okay, Lisa, first question. If I'm selecting a vegetable side for dinner tonight, should I pick asparagus or potatoes?
Asparagus.
Correct. Potatoes are high in phosphorus and potassium, so you're going to want to avoid those. Next question. Should people living with kidney disease have a diet that is high in dairy?
No.
That's right. Dairy products present a triple threat to kidney patients since they're high in phosphorus, potassium, and calcium. Last question, Lisa. For all the marbles, which of these is not a phosphorus additive?
None of them? They're all phosphorus.
That's right! When reading a nutrition label, phosphorus won't necessarily be labeled flat out. Anything including phos is most likely added phosphorus, which the body absorbs. You win!
I win? I've never won anything before. This is life-changing.
It sure is, Lisa. It sure is. Grocery stores can be intimidating when you're on a limited diet. Let's take a walk and I'll show you some tips and tricks on where to find kidney-friendly foods. It may seem overwhelming to identify which foods you can or cannot eat, but I have a few tips for you.
Oh no. Is that her? Derek, grab a mop.
As a good rule of thumb, fresh food is best. Avoid processed foods whenever possible since phosphorus is often added to these. Processed foods have been changed in some way during preparation, and you will often find these foods bagged or boxed, like cereals, frozen dinners, and frozen meats. Processed foods have higher levels of fat, sugar, and salt, so you should limit or avoid eating these foods. You'll want to limit the time you spend in the middle section of the store because this is where you'll find most processed foods. Luckily, almost everything here will have a nutrition label. Let's see here. Phosphorus is not required to be on the food label, but you can find the added phosphorus in the ingredient list of packaged foods. Avoid foods with a phosphorus additive in the first half of the ingredients list, or foods with 2 or more types of added phosphorus. Most of the stuff here is packed with phosphorus: canned goods, frozen dinners, and frozen meat. I always tell people to spend the majority of their time in the produce section to pick up fresh fruits and vegetables that are low in phosphorus. Limit the time you spend in the middle section of the store. This is the danger zone for kidney patients. It can be challenging trying to identify the right foods to eat to maintain a healthy phosphorus level. Have a conversation with your dietitian and ask them to help you develop a personalized meal plan.
Phosphorus-friendly diet for people with kidney disease can be indeed challenging. However, by eating better, you'll feel better and live better because controlling phosphorus will improve the quality of your life while on hemodialysis. Thank you for listening and participating in this teaching session. Now let's have a kidney talk.